Hi, I'm Patty Sear. Today's session we're going to be talking about artificial intelligence in healthcare. A simulation of human intelligence in machines and using software and programs to analyze data and problem solve. And we know this has been around a while, but we're going to see more and more of this in the future. And you may have heard in the news that Google's really getting into this and helping with skin conditions because they found that there were so many searches online for people trying to figure out what skin disorder they had. And they say it's not to diagnose, but you can take some pictures of your condition and Google can analyze it. I believe it's up to 288 conditions or somewhere around that. And then take that information to your doctor. And why do we even have artificial intelligence? Well, it really can be very efficient. It can help doctors diagnose and treat. It can be kind of a supplement to doctors. As we know, there's a shortage of doctors and doctors have burnout. They don't have time to do all the research. You find patients doing their own research, which I'm in favor of, as long as you bring that information to your doctor and don't try to diagnose yourself. But these machines can analyze a massive amount of data in a very efficient time frame. It can really free up the doctor's time. So hopefully the doctors will have more time with patients as this AI gets even more evolved. So I am in support of that. We'll have to see how it all plays out. I did read online, there's an interesting website I'm going to give you. It's a scenario of a nurse treating a patient, and the doctor and the nurse pretty much didn't agree with the AI system. So it gets into, who do you believe, the system or the human being? And it's pretty interesting to look at. So I'm going to give you a copy of that website. It's right here. And there's other things with these AI systems in terms of predicting outcomes across race, gender, socioeconomic status. How will that play out? We have privacy concerns, ethical concerns, and already some research shows that patients are a little bit skeptical of this when it comes to non-standard diagnoses. For example, just like with the automated cars, if we have an unusual situation, how is the machine going to problem solve that? And I do have a concern with that as well, as this relates to the health field. So we'll have to see how that plays out. I had a homeopathic doctor years ago who utilized, what he did was, he analyzed me, it took my history, but he put that information into a computer system to determine the appropriate homeopathic remedy that he would give me for my treatment plan. And it worked out really well, and he said it saved him so much time. So I had a really positive experience with that. So I do think this can work out well, but there are these non-standard conditions that we'll have to see how it plays out. And AI is also used to read images, CAT scans, detect cancers, liver cancer, prostate cancer, heart conditions, and there's a good website you can go to where you can read a little more about that. And this is the website. And we also know there's robotic surgery, which I'll talk about in another video. So I just wanted to bring a little bit of attention to this. It is the way of the future, and we're going to see this rapidly progress, I think, and we'll have to see how it all plays out. So that's it for today, and please join me next Friday.